Okay, so ladies and gentlemen, with great privilege, I want to introduce a colleague and friend of mine, Dr. Kenneth Fung. Dr. Kenneth Fung actually has a very, very long resume. If I go through his resume, it will probably take the next half an hour. But to make it very, very short and succinct, he's one of our most prominent Chinese psychiatrists. He is the head of the Oh, Dr. Chen is here. Okay.
The program?
Okay, go with, well,
But it's okay.
it's okay, it's okay. Dr. Fung first, go. To save time on switching. So it's one of our preeminent psychiatrists in our community. He is the director of the Asian Initiative in Mental Health Program at the Toronto Western Hospital University Health Network. He just also got promoted to be a professor in medicine. Very proud of him. I also have the privilege of working with him in the Chinese Canadian Medical Society, as well as the Federation of Medical Societies in North America. And without further ado, I'm going to pass it on. Just a background information. He's going to represent the specialist group, and while Dr. Chen will be talking about being a family doctor. Those are two large categories we talk about. But in being a specialist, there's so many of them. I'm one. I'm a cardiologist, but I also trained at some point being a family doctor myself as well. So we're going to have them dispel the myth of being a physician and how many options that we have in our field. So I always say there's one door that goes into medical school. There's 81 different programs that are coming out that you can pick up. So go ahead.
Okay, thank you. Thank you very much. And it's a pleasure for me to be here. Hi, everyone. And thank you, Dr. Chow, for organizing this event and mastering and inviting me to be here. So just want to say hello to you. My name is Kenneth Fung, and as introduced, I'm a psychiatrist. So over the next 15, 20 minutes, maybe I'll share with you a bit about my journey as a psychiatrist. But maybe before I do that, maybe I just want to poll the room. How many of here are parents? Raise your hands. Okay. Okay, good. And how many of you here are children, I guess? Children wanting to be something here. Okay, I can see a parent trying to raise a child's hand there. Okay, so, and can you tell me the reason why you're listening to me? Can someone shout a reason why you're listening to me? You're laughing. Okay, yes. You want to go to the same field as me? Oh my goodness. My first recruit as a psychiatrist, Dr. Chow. I'm so proud of myself. So thank you. You can come speak to me afterwards. Yeah, because we don't actually get a lot of opportunities to dialogue with the public about career. I'm Dr. Chow and myself. We do a lot of public education. And that's good, but it's actually not that common that we get to talk to, I guess, the public about what it is like to be a doctor. Even though I think people from the Chinese community, I think it's a common thing for parents to say to your children, "Go be a doctor." Is that still true? Yes. How many would say yes? You would say, go be a doctor. You want your children to be doctor. Okay, some. Okay, actually not a lot in the room.
Oh, they don't want to admit it.
They don't want to admit it. Because it's not always the case, certainly, and it really depends on a lot of factors. I remember actually talking to someone maybe 5 years back. She was actually telling me that when she was in China, it was the opposite. Like everyone was saying, don't be a doctor. So I just want to hear, when you hear like becoming a doctor, what do you people think of? Why would you want to become a doctor? Why would anybody tell their children to go be a doctor? What's the benefit of it? Dr. Chow said to dispel some myths. Yes. People will respect you as a good career. That's good.
Making lots of money.
Making lots of money.
Highly respected. In my case, when I was young, I was told that you'll get a good-looking wife. It's true, actually, but that's not related to being a doctor. Because my wife is here, I have to say that.
Oh, okay. Yes.
Meaningful life.
Helping people meaningful life. Yes, that's
true.
Good. That's very good. Yeah. Anything else? Any other reason to be a doctor?
Yeah.
To cure or to repair. That's very good. To cure or repair. Ming, you have to remember that. You have to cure people, okay? So
Always.
to cure and to repair, yes, absolutely, absolutely. Anything else? I think we've covered all the bases, right? So I think that certainly there are many reasons to go be a doctor, and I guess we're here to share that passion. Sometimes there are of two minds, I guess. There are some families who are doctors who say to their children, don't be a doctor. 太辛苦了. This is so hardworking, right? You have to be on call long. You have to study very long in school, and you can be very busy, right? So those are there are definitely some downsides, but then there are other doctor families, right? I didn't come from a doctor family. So let me tell you a little bit about my story then, about how I became a doctor, and see if it resonates with you, some of those things of why I became a doctor, and then why I became a psychiatrist, because I'm also representing psychiatry and a specialist. Well, once upon a time, I was a little kid like some of you here. I never went to a career talk. So I kind of didn't exactly know what I wanted to be. I mean, my first ambition was to be, I think when I was small, like an artist, you know, like drawing and painting. And of course, my parents would say, that's nice as a hobby, but it's not really a career. So they agreed to put me to, you know, take extra art classes on Saturday, Sunday, but just as long as I remember, it's a hobby. So, and then I thought maybe I want to be like a scientist and inventor of something new. And then I found out I wasn't really, I'm pretty smart, but maybe not a genius level. So that's neither here nor there. I thought about computer programming and IT, like, but Ming is half an IT programmer here. So he's actually had a successful software career. I guess the people who are doctors can also have other kind of talents too. But eventually, I actually became fascinated myself with psychology, how people think. So that's always been an interest personally of mine. Why do people do the things they do? Like, why are you sitting here as opposed to at home, right? And why is this person sitting in this way? Why is that, you know, I have a lot of curiosity about what makes people do the things they do. I think that's kind of curiosity about how people work and how people think, but also about how to help people, like someone said, right? So I'm always someone that people tell me their, you know, secrets. Of course, I'm very good at keeping secrets. So I kind of like that idea of helping people. And I also remember one of my first inspirations was that I grew up in Hong Kong. I don't know. I think I told this story in my professorial lecture if you're interested. But I remember when I was small, and when anybody can speak Cantonese here, raise your hand. Maybe some people. Okay. So when I was small in Hong Kong, I listened to a Cantonese song by Hui Kun-Kiet. Anybody know Hui Kun-Kiet? Okay, only a few people with a certain older generation who's heard of him. But he had a song that, you know, sang about life and about how sometimes when there are things in life, you have it, you're destined to have it, you'll have it, but sometimes some things are not meant to be and you cannot force it. So I remember those, some of you might know what I'm talking about. So
命裏有時終須有，
命裏無時莫強求。So for that generation, you might remember songs like that. So I was impressed by, because he had two categories of songs. One is extremely rude, that all the parents say, don't even listen to him. The other category of songs were deeply philosophical. So I asked my, you know, dad, like, and first of all, I share a birthday with him. So that's another common thing. I asked my dad, like, why is he so good at songwriting? And he said, well, that's because he took psychology in university. He really understands how people think. And he can really tap into people's hearts, not only one person, but the whole community. So that really struck me about what it's like to be able to help and repair people, but really to understand and connect with people. 能夠明白個民聲，市民嘅心聲。So not only individually, but also community. I thought that was really amazing. So I had a deep interest in psychology then in high school, and I did various science projects on it, like studying the unconscious. I tried to manipulate my parents through experimental paradigms to see if it worked, to manipulate subconscious. So those who are here, who want to manipulate your parents, study psychology, you're going to get what you want. I can see some smiles now. It's just basic principles in psychology is all out there. So I found it fascinating to be able to understand people, to be able to help people who are deeply distressed. So I did go to med school with psychiatry in mind, because here it is a perfect match. My parents said all the reasons you mentioned. Go be a doctor, people will respect you. You're not going to starve. They were saying that no matter how economy turns, eventually someone will get sick. Eventually they're going to need a doctor. So you're going to be never out of a job. So there's like, people need doctors, people respect doctors. And I thought, hey, and I can also maybe become a psychiatrist. So a doctor who understands, who can talk to people in distress. Wouldn't that be amazing? So I went to medical school and then I became a psychiatrist. Just to let you know, back when I was doing it, you only need 2 years of university and you can get into med school if your marks are good enough with high MCAT and high marks in university. So I was one of those, I think. I think now it's much harder. Now, basically, you need like 3 years.
Yeah, I think that was a special expedited pathway through U of T. I think it's much less common that we have now. So at least 4 years of undergraduate before you go to medical school.
Yes. So this is what I said earlier about the long road. It's a commitment. 10 minutes left. Okay. So I became committed to it, and 2 years of undergrad, and I went to med school, 4 years. So 4 years of medical school. And then at the end of 4 years, you get to choose what you want to become, and you're going to hear the amazing career path of becoming a family doctor, which I also consider. I also consider internal medicine. I actually didn't consider internal medicine before going to medicine because that wasn't the reason why I went in. But actually, when you start learning about the human body and you become fascinated with it. I know everyone is nervous about, having to dissect dead bodies. I mean, that was the not so good smelling part, to be honest. But it's really amazing to learn about the human body, how human body functions. So even though I went to med school saying, hey, I don't think I care too much about the human body, it's actually very fascinating to be able to also learn about the human body, how to heal, how to repair disease processes, how to prevent illness. So I did seriously think about internal medicine. My first choice was U of T psychiatry. My second choice was U of T internal medicine. I would have been really happy going into either one, to be honest. But my first choice was still psychiatry because I share with you my interest in really helping people through psychological issues. So I told my parents, I'm going to be a psychiatrist. And so this is where in the beginning I had just a little bit of resistance because that's when they said, well, but you have to be a real doctor because you spent 4 years in medical school. A real doctor. I said, what's a real doctor? They said, a cardiologist, like Dr. Chow. Because psychiatrist is not a real doctor. And if you talk to crazy people, you become crazy yourself. Not to mention, you're going to get hit by one of those crazy people. So I have to think a lot about that, kind of like internal medicine. And my parents really wanted me to be a doctor. Now I'm going to be a doctor. I'm in med school. And now I have a choice. And I got good marks in internal medicine. Actually, I won the internal medicine award for that school year. So I should be an internist. And even within medicine, I rotate through different rotations. And everyone says, you're smart. Why be a psychiatrist? If I can understand if you were just passing med school, go be a psychiatrist. But, you got pretty good marks. And of course, there are a lot of messages like that. So why do you think people are thinking like that?
So there's a stigma that we have to deal with? That these are soft science, for example?
Yeah. So there is mental health stigma. I kind of always knew about it, but it's always interesting to experience that it may also affect why not many people perhaps go into psychiatry. Because even though there are lots of Chinese that are going into medicine, there's relatively fewer, not none, I'm not the only, but there are relatively fewer that go into psychiatry, perhaps because people don't want to think about mental health, because there's a lot of stigma around it. But luckily through perseverance, I didn't do any manipulation, to be honest, but just perseverance, some tears. My parents agreed that I can be a psychiatrist, so the rest is this history, because I became a psychiatrist. Sometimes I do think, what would life be like if I'm a cardiologist or if I'm another specialist? But I've never regretted my choice. And just like what Dr. Chow says, you think you're going to go to medicine. Okay, I got the answer now. I'm going to go into medicine. But actually, once you go in, I just said there was a major decision point. I could have been a psychiatrist. I could have been in internal medicine. I could have been a family doctor, because that would have been my thought, that I would do a little bit of both. I can talk to people, but I can do some, and Dr. Li is going to tell you more about that. So I also thought about that, but they're just to let you know that after you make this choice, don't think that, okay, I don't have to have any more choices. Actually, the path is quite wide. But I finally chose psychiatry. So I thought that, okay, I chose psychiatry. Finally, I don't have to make any other more important decisions. But that's actually, I found completely untrue, because once you go into psychiatry, there are also another 80 doors I could have chosen. And this is something that truly surprised me, even like I went into psychiatry. And that is to say, because we think of physical health, there are so many aspects. You can be a respirologist, we can be a cardiologist, right? You can study any part of your body and become a specialist. So that's why there are so many specialties. But what about mental health? In a very similar way, once you go into psychiatry, there are psychiatrists specialized in giving biological types of treatments. There are psychiatrists who are more interested in psychological types of treatments. And there are many, many ways to help people with mental problems. So just to give you an idea, once you actually choose psychiatry, you will actually, because we have this discussion all the time, in psychiatry, you have to go 5 years of further training. So 5 years of residency. It's actually longer than if you go to the States. If you go to the States, you can become a psychiatrist in 4 years. So Canada, we actually have a 5-year system. So you have 4 years of medical school plus 5 years of residency. But the good news is you get, paid in residency. So you're already working. But because psychiatry is pretty big, you have to understand child psychiatry, how children think. You have to go geriatric psychiatry, how the elderly people think. And then you can go through the different kinds of rotations in psychiatry. So this is just to give you the breadth of psychiatry. I heard earlier someone mentioned cultural competence, I think the last talk. And maybe I'll just kind of wrap up here. I think facing psychiatry these days, a couple of issues. I think number one is stigma in the Chinese community we face. But from a mental health point of view, the other one is about cultural competence. So cultural competence about the importance of Chinese medicine. I heard that, Dr. Chow was mentioning that, because we have Chinese culture. And if you think about culture shapes everything we do, foods we eat that can interact with medicine, the actual Chinese medicine we take can interact with it, but also Chinese ways of thinking, Chinese ways of parenting also affect the way we think and feel, can also affect how mental illness both become mental illness and also present themselves, their experience and treatment too. So I think some of you might have heard some earlier talks about the importance then of paying attention to culture in the field of medicine. Cultural competence is important, and this is especially so in psychology and psychiatry as well. So I think that this story, I'm going to wrap it up now because I know I'm taking maybe too much time. But number one is sometimes you don't have to have exactly like your career path in mind, because this is like today's talk,行行出狀元. So I think many paths, you might think this is not exactly, I'm not sure, but I think if you sometimes you have a passion, you know, you go for it. Other times, like once you develop, once you get into the field, you can develop a passion and interest for it if you have an open mind. And so there are no wrong paths. So think about it as there are no wrong doors. There are just many, many doors of opportunities. And even when you think, okay, that's the final one, I'm trapped. Maybe your parents force you, maybe certain university choices you may end up with being placed in a certain career. You don't ever have to give up hope, because once you open the door, there are many, many other doors to open. So this is a time of opportunity of opening doors and exploring different things that you're interested in. And you don't ever have to feel you're boxed in, because there's always more to discover. So perhaps I will leave it there. I'm sure that might be time for questions after maybe Dr. Lee's presentation.
Thank you, Kenneth. So next we have Dr. Chen. While Dr. Chen is coming up, just want to acknowledge we're very fortunate to have Dr. Fung in our university. He's one of the leaders in the field of cultural competence and also multicultural psychiatry, because most of our Chinese patients, we try to refer to him at the Toronto Western Hospital, and he really leads the group and enables to help many of our immigrants who come to us who can't speak English. So thank you to him. So next we have Dr. Chen, who is a family physician at the Oshawa Clinic Group, where he practiced general comprehensive primary care. He was born in Taiwan and spent most of his childhood in Vancouver. And then he moved to Toronto, and then he received his honor BSc Master of Science program. I think that's in McMaster, right? Toronto as well. Okay, so McMaster has one, and many people go through that route to become a doctor, and which you'll hear more about. And then also being an MD from University of Toronto. He's currently an assistant professor at Queen's University, Department of Family Medicine at Queen's, and enjoy teaching medical students and residents. He's also an investigating coroner for the Office of Chief Coroner of Ontario, and and regularly served the region of Durham. So 呢個法政先鋒係解剖 So that's part of the coroner parts of it. So happy to hear about your multifaceted practice of being a family physician.
All right, thank you so much for the kind introduction, Dr. Chow. And for Dr. Fung, my growing up, what I wanted to be was an astronaut, just for record. But I translated over that to my kids. My kids' names are like Luna and Castor, so very space names as reference. Okay, so I guess Dr. Chow already basically introduced my roles that I do. So I currently have I spend my time in three major fields. One is a family doctor. I also teach for the Queen's University, and lastly, I'm an investigating coroner. So that is approximately how much I sort of allocate my time to. So majority of the time in the green there, I still spend as a family doctor. And I spend approximately 10% of time in each of the teaching and the coroners. So first off, let's go through what I do as a family doctor. So I heard like there's the whole thing about taking your kids to work day, that still is going on. So why don't we visit my office and just, I'll take you through maybe like a typical day here. So first off, we have this is Adrian, and Adrian is a newborn. He's here for a baby visit. What do you have to do? Well, you have to take the height, the weight. You have to listen to the heart. Maybe he's got a rash here that mom wants you to take a look at. All these things, although he's healthy, you still got to make sure that he remains healthy. You've also got to give him the routine immunizations. So that's a lot about preventative health. How do you keep a baby healthy if they already are healthy? Let's go to the other extreme of the age spectrum, maybe the senior. This maybe Betty. Betty has the three highs: the high blood pressure, high sugars, high cholesterol. we call that hypertension, diabetes, and dyslipidemia. Very, very common chronic illnesses. So you have to be able to manage that as well. As a family doctor, you have to, maybe you want to employ the expertise of those previous talkers that you've listened to. So, for example, maybe you'll need a dietitian to get her to eat better. Maybe you'll need to have a physiotherapist, occupational therapist, to let them guide Betty in her disease journey, and for her to get the best optimal health, so that she doesn't end up, for example, with some sort of heart attack. And then next we have a walk-in. I mean, one is something what we call Bell's palsy, which you can manage with just some steroids and antiviral therapy. You can send them home. The other one is a stroke. Which one do you think is which? Well, anyway, it's the one on the, it's the person on the right there. So as a family doctor, sometimes you never know who's going to walk in. Maybe they'll be walking in with a stroke like this. Every minute that you spend with them, their brain might be dying. And so you have to think on the spot. You have to manage these acute issues. So from the chronic illnesses to these acute things, you have to be able to manage. And next, maybe we have Elizabeth here. Elizabeth, she came in a few months ago. She's lost some weight. Her skin is looking a little bit yellowish. And I ordered some imaging and MRI, and today I have to tell her that, she has pancreatic cancer. And how do I break the news to her? She's may have a million questions. Doc, is this curable? How long am I going to live? Who's going to take care of my dog when I'm gone? Who's going to take care of my kids? How is my spouse going to have income? These are questions that the patients are going to have for you, and you're going to have to answer to those. Or you may have to also recruit the right team to help you out manage these patients. It's not all just cognitive thinking, a lot of thinking, internal medicine. There's a lot of procedures that you can do as well. You may, I typically do injections of steroids for those people who have arthritis. You can treat warts. You can, if someone falls, they have a tear, you can suture them up. So these are well within the expertise of a family doctor. And just as you think the day is over, maybe you want to sit down and have some lunch. Well, there's a lot of paperwork that's involved as a family doctor. This is a screenshot that I took of my inbox, after from the morning to noon. That's in the span of just 4 hours. I've accumulated like 26 different things that I've ordered. Maybe it's blood work, maybe it's some CT, MRI scan that I have to review. Maybe most of them may be good. Some of them I have to review and think about how to manage. And, there's like prescription renewals. That's also a lot of what we have to do as a family doctor. Yes, so a lot of paperwork. If you're applying to med school, you have to get all these immunization forms, insurances, disabilities, things. So if you think that it's all about the treatment, well, there's a lot of social work involved as well with being a family doctor. So why family medicine? It sounds so complex, right? But that is exactly why, one of the reasons why I chose to be a family doctor. It's because of the diversity. You see patients from basically cradle to grave. You can see them as a newborn, as a senior, every spectrum in between. You get to think about internal medicine things. You get to do hands-on procedural surgical work that's of your interest. At the same time as you can make your scope so broad, you can also be very focused. So after family medicine, you may choose to enroll in one of these what we call added competencies of family medicine. You can choose, for example, if you want to do obstetrics only, you want to just deliver babies, well, yeah, just do an extra year in family of training, and you can deliver most of the babies. And so family medicine is very flexible. You can choose to make your scope of practice as broad or as narrow as you want. Which brings me to my next job. So the other thing that I do on a regular basis is coroner. And as Dr. Fung said, it's not something that a lot of people want to get into in the Chinese population. I actually got mine from watching too much anime and manga. I watched a lot of Conan as a kid, and hey, it would be cool to work do a lot of detective work, and that is a little bit about why I chose to be a coroner. And as a coroner, what do you really do? The motto that we have is we speak for the dead to protect the living. How do we do that? So you do that by answering the 5 questions. There's 5 general questions that we have to answer as a coroner. The identity of the deceased, where they died, when they died, and the medical cause and the manner of death. And then you can use the answers to these questions to maybe make recommendations on how or specific policies in order to protect the living and the broader community. So spend some of my time doing this. It's really cool. You get to drive out at night. You get to work with police. You get to work with forensic pathologists. So just as a note here, I don't do autopsies. That's for the forensic pathologists. I'm kind of like the family doctor for the dead. So I still take the history, I still do a physical examination, and I refer to the forensic pathologist should I need an autopsy in order to answer those questions. So next is, how do you become a family physician? And because I know there's a lot of, I guess, high school students here as well. So I'm going to bring my focus on that part of the transition from high school to medical school. So how do you basically essentially get into medical school? This is OMSAS. I think it first started about 2 years, 2004. I can't exactly remember, but it was around shortly before I went to university, and it's still around. So the OMSAS, Ontario Medical School Admission System, is the website or the portal you want to use to get all the information on what exactly it is you need in order to get into medical school in Ontario. But it's actually medical school across Canada, although there are subtle differences on the admission requirements. They are the same in terms of what they assess. So this is a framework that if you're interested in applying to medicine, that I would suggest you look up. It's called the CAN-MEDS rules. So these are specific skills that medical schools are looking for in applicants in order to see whether or not they're going to be a good physician. So there are various skills. For example, what we mean by like a scholar, well, you have to have excellent, grades. You have to be able to interpret scientific data, know what's the true and the false information. As a professional, we are obviously professionals. You have to have the appropriate ethics and values to become a physician. Communicator, collaborator, and leader. Like I said, there's many diseases in which it's very difficult, if not impossible, to manage by yourself. So you need to gather a team. You need to be the quarterback of, in order to assimilate all the resources for a particular patient. So you have to be excellent at communicating, collaborating, and being a leader. Health advocate means that as part of a professional, as being a doctor, you need to be able to contribute to society and also promote health in general. So if I were to break it down into 4 general categories there, medical schools are looking, first of all, at your academic ability. So that would be your GPA. Remember there was a question during the nurses talk about like, so if you need like 90% as a nursing student, like why not apply to medical school? Well, probably not as easy as you think to get a good grades and GPA in university. I remember there's a question in my first year biology. First year biology took place in this huge convocation hall with like over 1,000 students. They had a question there, like, who wants to go to medical school? And we back then we had these little eye clickers to know like to keep track of the polls. I remember exactly 92% of the class of 1,000 or to 2,000 there wanted to go into medical school. And then the professor said, okay, well, only about maybe 5 to 10% of you will actually get into medical school. It is actually quite difficult. If from high school to university, I think the average admission grades that you need, which is like 85, 90%. My very first chemistry examination, the class average was 68%. And these are students who got like in their 90s in high school. So grades are very, very important. So I can't stress enough. If you are interested in medical school, grades is very, very important. The other things like the MCAT, medical college admission tests, also important. You can take that in your typically in the second year of your university. And not the non-academic portion is where you demonstrate the other aspects of the CAMMED's rules. Lastly is interviews, but it's just an in-person or now virtual way to get to know you a little bit more. This is the University of Toronto's medical school admission, their academic requirements. You can look this up on their website, but I just want to point out, for example, as an undergraduate, if you want to apply to medical school, you must have at least 3 years of undergrad education. The minimum undergraduate GPA requirement is 3.6 here, but don't let that fool you again. Right now, I think the average admission for U of T back in my year was 3.92 or something, and then this year it was something really crazy, 3.95. So crazy that I don't think I can even get into medical school with.
Neither can I.
Yeah. Let's go to the next one. So a little bit about your non-academic abilities. This is something that I did during my undergrad years, which is establishing one of the music therapy program at Mount Sinai Hospital. We called ourselves the Mount Sinai Minstrels because we went around and played music for the patients. So during your university years, how do you demonstrate that you can put together this? How do you communicate with different, like the volunteer organizations? How do you recruit all these musicians? And how do you become an advocate of health? This is just one way of how I did it to demonstrate my non-academic abilities. A little bit on alternative ways to get in. So this is some medical schools may offer ways of getting in directly from high school. This is the Queen's program. You can apply. However, you must declare yourself as having an indigenous or Black ancestry background, but it is another way of getting into medical school directly from high school. How do you become a family doctor? There's also another way. You still have to get into medical school, but this is the Queens Lake Ridge Health MD program, which I'm going to be involved in starting this year. They're accepting applicants starting in the fall of 2023. Basically, this is a program. This is a medical school program, but you must commit to family medicine. So instead of having the options of saying, oh, I want to be, for example, a psychiatrist or other specialties, you've committed to family medicine, that's it. But this is another path that you can take for medical school. It was like I said, so this is a convocation hall at U of T. I actually said this a little bit earlier, but that was first year biology and first year physics for me. It took place in this room, and like I said, over it can fit over maybe 3,000 to 3,000 people, a whole bunch, and that's where the professors asked, like, who wants to go into medical school, and it's like almost everyone clicked it. But yeah, it is a very challenging field to get into, but incredibly rewarding at the same time. Earnings. I know there's a lot of parents here who wants to know a little bit about the earnings. This is data taken from the 2019-2020 data, so a little bit out of date, but that's what I can find. That's the average gross annual income for family doctors. You can know that Ontario is somewhere between about $300,000, but know that it is the gross income, meaning that family medicine is still a business. You're still an entrepreneur. You still need to pay for things like the office space. Anything that you see there, as simple as a pair of gloves, like these disposable things. I remember when I was a fourth year medical student, when I was studying under a family doctor, you have to draw up these vaccines from these little vials, right? And then they have these rubber things at the end, and when you puncture it, it actually dulls the end of that needle. And then he would take the same needle and just apply it to the patients. And ask him, why don't you switch to a needle so that the patients have a little bit less pain? And his answer was, well, who's going to pay for it? It's going to be on the family doctor, right? So little thing that you use in the office, actually you need to take out of that earning. So that's just a little bit about the income of family doctor. Prospects. I think we touched on this during our keynote speech. Yes, AI is coming, can't avoid it. These are some of the interesting articles that I've gotten, like the one on the bottom right. The ChatGPT clears the U.S. medical licensing exam. They actually got like 90% on the U.S. licensing exam, so they're better than most doctors. Talk about how ChatGPT. You need that human touch, but look at the article on the left. Like, ChatGPT gives more empathetic bedside advice to patients than doctors, according to some studies. But it's basically what I'm trying to say is that doctors are it's going to be challenging. You will need to constantly adapt to these challenges, but physicians, I don't think they're actually going to go away. These are very, very new. That's what they said about, like, for example, when TVs is going to replace all the radios. There's going to be people. There's going to be humans. There's going to be doctors at the end of this, in order to determine what do patients value. You need to be able to assess that, and in order to provide the best medical care. So in short, I think as a family doctor, or for most doctors, it's still safe, but you'll need to you'll need to adapt. And, that's a quote from one of my favorite movies, Lord of the Rings, at the end there. I think I'm quite ready for another adventure.
Thank you.
Thank you.
So now let's move on to our Q&A session. So both of our speakers have like fantastic stories to share, and they have like a vast experience. Just I happen to have actually done family medicine and internal medicine and cardiology. I just didn't know what I wanted to do when I was growing up. But family medicine, from what I heard when I first joined family medicine, is a knowledge of breadth. So you like variety, you like to deal with people of like, a vast around age from cradle to grave. In Dr. Chen's case, is actually beyond grave. And Dr. Fung actually really, has made a lot of contribution both on the patient care and research and community work. So I'm sure there's a lot of things to talk about. And being a specialist is a knowledge of depth. So one of them is breadth, and one of them is depth. No matter what, getting into anything is actually quite difficult. Not only medicine these days. So if you think medicine is difficult to get in, trying to get into computer science in Waterloo is not easy either. So for things that you really are competitive, they are competitive, and but whatever price that you pay, you'll get good rewards. So questions. Oh, there's some behind me. So go ahead, please.
How does the family doctors work with specialists? So generalist, specialist, how do you refer to each other and how to work together?
Okay, so yes, so it does start off from like from a family doctor. I would say for typical family doctor, you may refer maybe like 5 to 10% of your cases. When we write referral letters to specialists, we ask them, or we try to ask them, very specific clinical questions. So for example, what does that mean? It's like, so I know this patient has depression. I know he's tried medications A, B, and C, has tried this psychotherapy, but it's not working. Can you help me by giving me some advice about where to go next?
Yeah, that's a very beautiful answer. So we work often, in partnership. I think, especially in the Canadian system, family doctors are the gatekeepers. So any kind of problems, you go to the family doctor first. So most specialists will not take people directly, like, oh, I think I have a cardiology problem. So Ming is going to say, hey, please see the family doctor first, because it may or may not be even heart problem, right? So you're the gatekeeper of the healthcare system, and is the family doctor, and as Dr. Chen says, that for many, many problems that the family doctor would be able to manage. And then for those that need to, they can refer to specialists. And there are different models of how specialists and family doctors work together. In mental health, first of all, there are GPs or family doctors who specialize in certain things, like sometimes some family doctors specialize in OB-GYN or psychotherapy. So there's some GP psychotherapists who would actually do a lot of psychotherapy, maybe better than some psychiatrists, right? And then there's in the mental health, there's a concept called collaborative care, meaning that there are some family doctors and some psychiatrists, they work more almost like a team. And then the psychiatrists would sometimes not see patients directly and consult to the family doctor. So there are also collaborative care mental health networks like that. So there are many kind of ways of collaboration. Collaboration is certainly a key that, between the two arms.
Questions?
Back to your childhood or teenage years, what has helped both of you to succeed in your career?
Honestly, I think the number one thing is learning how to type, and type really, really fast. I remember I had a bunch of games on my computer. It's like there was like a Casper the Ghost where I had to like type really, really fast. And honestly, that's one thing that I think is the most valuable for me, because you have to document a lot. in family medicine and like writing referral letters to our specialist colleagues, that is a lot of paperwork. And I mean, with technology getting better and better, but still typing, I think is actually the one that benefited me the most, among other things.
I guess several things. I think number one for me would be study habits and the idea of needing to work hard. I think that's instilled into me and I think most Chinese families. It's part of that Chinese cultural tradition, for the better or for the worse. And I think that has an impact. We know that culturally that has an impact. But of course, I think that there is a cultural difference between, studying hard in Asia and studying hard here. In Asia, you study hard when you're in kindergarten. And here, there are no losers. Everyone get a participatory, prize. So it's vastly different. So there are differences in cultural values. But at the heart of it, the need to work hard, I think it's an important thing. But number two is the influence of peer groups. We know that psychologically, when you're really young, you're really influenced by your parents. And to parents' shock, that's no longer the case as children grow up. You can say the same thing 10,000 times. It's not as good as if their friends say something like two times, like, don't play this game anymore, it sucks. They will stop playing this game. But you can say, shut your phone now, and they don't listen. That's because they listen to peers. So I think having peers influence can be also important. And I think reflecting back, I think peers have influenced me. So who you surround yourself with, it is true that you can surround yourself with people who do encourage you to a certain path, and you can be involved with, other peers that help you to catch down as opposed to kind of catch up. So I think the peers' influence is also important. And then bridging that cultural differences, I think, is important because I see a lot of kids in this new generation. And having that communication now, if you're a parent from Asia, to know that there is a cultural difference. How do you talk in a language that motivate your kids in a positive direction, as opposed to sometimes the more you say, sometimes they do the opposite. So having that way, I just saw a mother saying, see, you do the opposite. So having that parent-child dialogue, I always now say to the parents, like, sometimes you can really force them to close the phone right now, but it's kind of like winning the battle, not the war, right? So sometimes we have to develop that relationship, because at the end of the day, I have parents that literally threw the kids' phone out the window, literally did that. And the kids remember, oh, you threw my phone out the window. I can't believe it. And this kid is like telling, oh, it's not no longer a kid, but still telling me this is what my parent did. But at the end of the day, if you lose that relationship, that's then there's nothing left. So I think that relationship is still so vital and key. So I have, great support from my parents. I said, we have differences of ideas, but at the end of the day, we're very supportive of me. So parents support that kind of unconditional love, that, okay, fine, you don't do what I say, but I still love you. Because that's what, I'm shocked when I talk to the younger kids these days. Actually, a younger kid just said to me some months ago, you know what, my parents don't really love me. They only love my marks. And I said, what? This is what you really think? And they said, no, this is what I really, really, really think. This is what this person believes. And he's like in high school, like graduating. And she's in tears. So this kind of dialogue is so important, because, parents from Asian country, they say, you must get 100%, but this is for your own good. But here in these days, this is not the language of communication. So I think that's also important. I don't know if this is a long-winded answer, but I think that's also an important factor.
Yeah, maybe I'll add my comment as a physician as well. I think, having extremely supportive parents are very important, both in, in spirit as well as, providing financial support, because I actually finished family medicine around 26 27 roughly around that point. I finished my cardiology around 34 or 36. Depends on how much you want to go into. If you want to do like, subspecialization in a subspecialty, that will take actually more time, especially when you want to get a teaching position at, like, let's say U of T, for example. And then having during all these times, some of your colleagues and like your friends already, get promoted along the way, making money, buying condos or buying houses. And then, you have to make all these sacrifices along the way to achieve what you want to do. But then again, the reward is huge. Like, I'm still enjoying every day what I do. I don't think I would be very happy to be an iBanker or financial person myself or a lawyer. But, every day I enjoy myself. I think the investment that I had of all these long hours of studying while my friends are partying, I'm in the science library studying, all those hours at some point at this point pay off for me. I'm sure for my friends and colleagues here as well. And I think, as a parent, you have to understand that because it's a very long path that they're not making a lot of money compared with their peers. So it's a delayed gratification or delay sort of like, growing up because you're in school for so long.
Definitely that enjoyment of being able to help people piece that we start out with the same.
Yeah. But the investment is huge, but the reward can be very big as well. Questions? I think we can only afford one last questions and then we're to close.
You mentioned that have to work long hours and face all different nations. If you reach your career, you want to be a family doctor or specialist?
I think I still want to be a family doctor. I see it was because, like Dr. Fung said, like everything, once you learn about the human body, it's actually so fascinating, like, and all these things. And I embrace diversity and trying to, like, seeing the different things. It's what I enjoy as part of my career. So I would not pick. I would still pick family medicine. And remember, there's still at the added competency piece, so you can still mold yourself into the different specialties if you wanted to, except surgery, maybe.
Okay, so one message I want to give is, I would never force my kids to go into medicine. It's really hard. It's not something that you easily accomplish, and you really have to put in a lot of effort and lots of sacrifice. And when my kid comes to me and say, "Well, I don't want to become a lawyer. I want to become a doctor," I said, "Are you really sure?" Then you have to guide them. Like, I'm supportive. I'm not forcing them to do anything because whatever they do is going to be hard these days. Whether you want to become a lawyer or computer science person, banker, it is hard work. Or my friends who works at like KPMG, they have to work long hours. So every business that you go into have to work pretty hard. So it's just a matter of where you want to work hard. So just make your kids decide on their own and support them because I've seen lots. I'm sure Kenneth also, we teach, and I'm sure Dr. Chen, we teach. We do see certain doctors, junior doctors, but because they are forced by their parents, and by the time they get to the end of their training, they get really tired and actually burn out already before even they start their career. So just very careful. So once again, I want to take this opportunity and thanks to all our speakers, all our volunteers, and all the organizers, colleagues and friends. And it's really a fantastic opportunity to have everyone here to hear about. This will be available online, and then you can review. And with that in mind, we're just going to take the last picture and then let you all go home and think about all this. Thank you. I'll move this side.